Picture this for a second. Imagine there was a miracle drug out there. A medication that is completely free, universally available no matter where you live, 100% safe, and incredibly effective at managing both type 2 diabetes and high blood pressure. I mean, it sounds like a total joke, right? Or like some scammy late-night infomercial. But this magical prescription isn't sitting behind a pharmacy counter. It is highly specific, targeted physical movement. Welcome to today's Explainer, where we're going to do a deep dive into the medical literature to show you exactly why exercise isn't just generic, feel-good advice. It is quite literally a powerful medical prescription. Okay, let's dive right into this with a number from the research that absolutely blew my mind, 24. So what does that mean? Well, it means that a single focused exercise session acts exactly like a prolonged release medication. Just one single workout has the power to keep your blood sugar suppressed and actively managed for a full 24 hours afterwards. That is a massive physiological return on a really small investment of your time. To get the most out of this, consider this your official patient information leaflet. We are going to cover 1, the mechanism, 2, the formulations, 3, clinical dosage, 4, warning labels, and 5, administration. Let's get into it.
Part 1. The mechanism. Bypassing the insulin key. Before we can prescribe movement, we have to understand how it actually alters your cells. Normally, your cells absolutely rely on insulin. Think of insulin as the mandatory key required to unlock the cell door so that glucose, your blood sugar, can get inside. But look at the exercising muscle. This brilliantly illustrates how, when you contract your muscles through movement, they become totally self-sufficient. They act like these giant sponges that bypass that insulin key entirely. They literally soak up glucose directly from your bloodstream without needing insulin at all. It's the ultimate natural override switch.
And what makes this prescription so incredible is that it hits 2 targets with 1 arrow. For diabetes, it not only acts as that glucose sponge we just talked about, but it actually increases your body's overall insulin sensitivity. And for your blood pressure, it directly lowers both your systolic and diastolic pressure by an impressive 5 to 10 millimeters of mercury. Honestly, long-term use of this natural drug actively protects your delicate nerves, your kidneys, and your eyes from diabetic complications, all while drastically slashing your risk for a stroke or heart disease. Moving on to part 2, the formulations. Choosing your pill. If exercise is the medicine, you actually have several different pills to choose from. A holistic prescription isn't just about doing one type of movement forever. Combining various modalities, whether it's finding your zen in yoga, cycling outdoors, going for a brisk walk, or swimming, creates this comprehensive, balanced lifestyle approach to chronic disease management. You're building a routine that touches every single aspect of your physiological health. Let's break down the mechanics of the 2 main types to build our perfect prescription. On one side, we have aerobic formulations. This is walking, swimming, cycling, or dancing. These are your oxygen pumps. They get the heart rate up, they pump oxygen everywhere, and they physically enhance how well your cells absorb insulin. On the flip side, we have strength formulations. Think squats, push-ups, lunges. These physically enlarge your muscle mass. And remember our sponge metaphor from earlier? More muscle means a bigger, more powerful sponge to rapidly drain that excess sugar from your blood. But listen, we cannot forget the mind-body formulations. You might think slow movements like Tai Chi or yoga don't really do much, but their clinical power is staggering. By engaging in these gentle, balancing movements, you directly lower your stress hormones. And why does that matter? Because cutting out stress hormones actively stops your body from triggering sudden blood sugar spikes, which in turn soothes your blood pressure and actually helps heal the nerve damage caused by diabetes. It's an absolute game changer. Okay, part 3. The clinical dosage, hitting the targets. We know the medicine works, but it's only really effective if you take the correct dose. The golden clinical target is 150 minutes per week. Now, I know 150 minutes might sound a little overwhelming at first glance, but stay with me. We are not asking you to do this all at once. We're going to break this down into highly manageable, bite-sized daily doses. So the crucial point is how you customize this to fit your actual life. Here are your daily administration options. The standard dose is simply 30 minutes, 3 to 7 days a week. If that's too much right now, take the starter dose. That's just 10 minutes of gentle mind-body movement every day to soothe your nervous system. If you prefer walking, your exact pace target is 100 steps per minute. And if you have bad knees and need a joint-safe option, hop on a bike for 20 to 30 minutes a day. It's gentle on the bones, but it still burns right through that blood sugar. Let's shift gears to part 4, warning labels and safety. Hypoglycemia risk. I need you to listen to me very carefully here because we have to radically shift our tone for a second. This is not a joke.
Just like any potent drug, this carries the risk of adverse reactions, specifically hypoglycemia. If you're working out and your blood sugar plummets, your body will scream at you with these emergency warning signs: dizziness, trembling limbs, a sudden cold sweat, extreme hunger, or terrifying palpitations and chest tightness. Let me be absolutely clear. If you experience any of these symptoms, the mandatory rule is to stop training immediately. Not in 5 minutes, not after one more rep, right now. If you hit that wall, you must execute the Rule of 15 protocol. This is a life-saving method that every patient absolutely must memorize. Step 1. Stop immediately. Step 2. Consume 15 to 20 grams of fast-absorbing carbs. That means chewing 4 glucose tablets or drinking half a cup of fruit juice. Step 3. Sit down and wait exactly 15 minutes by the clock. Step 4. Test your blood sugar. It must be back over 100 milligrams per deciliter before you are considered safe.
Because prevention is always better than an emergency, here is your pre-dose safety checklist. Hydrate with about 500 to 600 milliliters of water 2 to 3 hours before starting. Next, and this is a strict rule, never train completely fasted. Waking up at the crack of dawn and doing intense cardio on an empty stomach is incredibly dangerous for this demographic. Don't do it. Always wear well-fitting sports shoes to prevent blisters that could turn into really serious foot ulcers. Always carry your phone and medical ID. And never skip your mandatory 5-minute warm-up to prep your heart and your joints.
All right, bringing it home with Part 5, Administration Strategies, Timing, and Tracking.
Let's take a breath, relax, and look at how to systematically integrate this into your daily life. Now, what's really interesting about this slide is this pre-workout traffic light system. It takes all the guesswork out. If you check your blood and you're under 100, you're in the warning zone. You must eat light carbs before training. If you're between 100 and 200, congratulations, you're in the green, safe zone. Proceed as normal. But look really closely at the bottom. If you're over 250 with ketones present, or over 300 regardless, you are in the danger red zone. Do not train. Exercising in this state will actually trigger your body to aggressively spike your blood sugar even higher. It is incredibly dangerous.
Finally, when is the very best time to take your pill? The medical literature gives us highly specific optimal dosing windows. We're looking at the late afternoon to early evening, or exactly 1 to 3 hours after a meal. Why? Because dosing at these specific times perfectly manages those post-meal glucose spikes safely while heavily protecting you from sudden dangerous drops and preventing any sudden rebound spikes in your blood pressure. It's just the smartest way to do it. So, we've covered the science, the safety, and the strategy. You now hold the prescription to an incredibly powerful, natural, totally free medicine. So I want to leave you with a simple, provocative question. How are you going to fit just 10 minutes of movement into your day today? Start incredibly small, be persistent, and flip your body's miraculous healing switch right now. Thanks so much for joining me on this explainer, and I'll catch you next time.